Malnutrition is a condition that occurs when the body does not get enough nutrients to maintain proper health and function. It can result from an inadequate intake of nutrients, an inability to absorb nutrients properly, or a combination of both. Malnutrition can affect people of all ages, but it is particularly concerning in children, the elderly, and individuals with chronic illnesses. Types of malnutrition: undernutrition, protein energy malnutrition, inadequate intake of calories and protein, leading to conditions such as marasmus, severe weight loss and wasting of muscles and fat. Kwashiorkor, characterized by protein deficiency, causing swelling, edema, irritability, and an enlarged liver. Micronutrient deficiency, lack of essential vitamins and minerals, such as iron, vitamin D, iodine, and zinc. Overnutrition, excess intake of nutrients, particularly calories, leading to obesity and associated conditions such as cardiovascular diseases, diabetes, and metabolic disorders. Causes: inadequate dietary intake, insufficient access to food, poor dietary habits, or economic factors that limit food availability. Health conditions: chronic illness, conditions like cancer, heart disease, or chronic infections can increase nutritional needs or reduce the body's ability to absorb nutrients. Digestive disorders, conditions such as Crohn's disease, celiac disease, or chronic diarrhea can impair nutrient absorption. Increased nutrient needs during periods of rapid growth, e.g., infancy, adolescence, pregnancy, or illness, the body may require more nutrients, leading to malnutrition if these needs are not met. Social and environmental factors: poverty, war, displacement, and natural disasters can disrupt access to nutritious food. Symptoms: general symptoms of malnutrition, weight loss, unintentional and significant weight loss, particularly muscle mass loss, fatigue, persistent tiredness and lack of energy, weakness, muscle weakness and reduced physical strength, poor immune function, frequent infections or slow healing of wounds, changes in hair, skin, and nails, brittle hair, dry skin, and ridged or brittle nails, delayed growth and development. In children, malnutrition can lead to stunted growth and delayed cognitive development. Specific symptoms related to deficiencies: iron deficiency, anemia, fatigue, pale skin, shortness of breath, and dizziness. Vitamin D deficiency, vision problems, particularly night blindness. Iodine deficiency, goiter, enlarged thyroid and developmental delays in children. Zinc deficiency, impaired wound healing, hair loss, and loss of appetite. Diagnosis: physical examination. Signs of malnutrition, such as wasting, edema, or changes in skin and hair texture. Body mass index (BMI). The BMI below 18.5 may indicate undernutrition, while a BMI above May 25 indicate overnutrition or obesity. Blood tests to assess levels of essential nutrients such as iron, vitamin B12, folate, and electrolytes. Nutritional assessment: a detailed evaluation of dietary intake, health history, and any symptoms associated with malnutrition. Anthropometric measurements: measurements such as weight, height, and upper arm circumference (MUAC) to assess nutritional status, particularly in children. Treatment: dietary changes. Nutrient-rich foods for undernutrition: increasing the intake of calories and protein through foods like lean meats, dairy, legumes, and whole grains. Fortified foods, foods fortified with vitamins and minerals, particularly in regions where certain nutrient deficiencies are common. Nutritional supplements. Oral supplements, such as multivitamins, iron, calcium, or vitamin D supplements, to address specific deficiencies. Therapeutic foods. Ready-to-use therapeutic foods are UTF or fortified milk formulas used to treat severe malnutrition in children. Medical treatment. Treat underlying conditions, e.g., gastrointestinal disorders that may impair nutrient absorption or increase nutrient requirements. Tube feeding or intravenous nutrition. In severe cases, where oral intake is not possible, feeding through a tube, enteral feeding or delivering nutrients directly into the bloodstream, parenteral nutrition may be necessary. Addressing the underlying cause. Tackling the root cause of malnutrition, such as poverty, food insecurity, or chronic disease, is essential for long-term recovery. Prevention. Balanced diet. A diet rich in fruits, vegetables, whole grains, protein, and healthy fats can help prevent malnutrition. Education. Teaching families and communities about proper nutrition, food hygiene, and the importance of a balanced diet. Micronutrient supplementation. Providing supplements such as vitamin A, iodine, iron, and folate to at-risk populations, particularly in low-income countries. Addressing social determinants. Efforts to reduce poverty, improve food security, and ensure access to healthcare are critical in preventing malnutrition, especially in vulnerable populations. Complications. Growth and developmental delays. In children, malnutrition can lead to stunted growth, developmental delays, and learning difficulties. Weakened immune system. Increased susceptibility to infections and illness. Organ damage. Severe malnutrition can lead to organ failure, including the heart, liver, and kidneys. Increased mortality. If left untreated, severe malnutrition can be life-threatening, especially in children and the elderly. Conclusion. Malnutrition is a critical global health issue that can lead to severe health consequences if not addressed. Early detection, proper treatment, and preventive measures are essential to reduce the burden of malnutrition, particularly in vulnerable populations such as children, pregnant women, and the elderly.